Hello, we are Presentation Group 34 and we will be presenting our problem statement, attracting and retaining nursing in the healthcare workforce. Our group will be using the Sociological Imagination Framework, also known as SIF, a tool to critically think and explore three different social aspects of the issue: historical, cultural, and structural. Such key factors and implications include the history, culture, and the hierarchy of nursing as a profession, and we'll be providing recommendations to this problem in the following slides.
The pandemic has highlighted key challenges faced by nurses globally, which contributed to the significant instability in attracting and retaining nurses post-COVID. Firstly, workplace vulnerabilities. The pandemic has brought to light the shortages of PPE, leaving many nurses exposed to health risks. Secondly, unsustainable workloads and inadequate staffing. Due to the surge in demand for nurses face an increased workload and work longer shifts to ensure uninterrupted staff coverage. In Canada, more than half of the nurses reported limitations to their vacation to meet staffing needs. Thirdly, the ongoing work-life stress. Heavy workloads alongside family responsibilities make mental recovery difficult. In Egypt, 75.2% of nurses reported higher stress, 98.6% had heavier workloads, and 51% had lower satisfaction levels. Alarmingly, only 4.8% of nurses in COVID-19 hospitals had no intention of leaving their jobs. These factors have contributed to nurses suffering psychologically and physically, including burnout and mental health challenges. Studies show 39% of healthcare professionals exhibited partial anxiety, while 36.7% had constant anxiety post-COVID. Additionally, the pandemic has also resulted in a shift in attitudes towards nursing. Public recognition boosted pride in nursing. In China, the proportion of nursing students choosing nursing as a future career rose from 50.9% pre-pandemic to 62.7% post-pandemic. However, in recent years, there has been a steady increase in the cases of abuse and discrimination towards nurses, fueling dissatisfaction and resignation. This sparked public uproar and government action. Thus, the Singapore Ministry of Health established a tripartite work group for the prevention of abuse and harassment of healthcare workers on 13 December 2023.
Following the historical context presented earlier, I'll now examine how cultural values and perception influence attraction and retention in nursing. The problem of attracting nurses is deeply rooted in Singapore's cultural hierarchy of professions. A 2016 study of Singaporean students found nursing to be widely perceived as a low-status career for those with poor academic abilities. Students describe nursing as a dumping ground for weaker students, whilst academically gifted students rank medicine, dentistry, and pharmacy higher due to its prestige. This reflects how Singapore's meritocratic culture equates academic performances with social worth, positioning professions that require higher entry grades to be more intelligent and respectable. As a result, nursing is viewed as a lesser choice, not for its lack of skill, but because it falls outside Singapore's definition of academic and professional success. This stigma is further reinforced by parents and peers who view nursing as less prestigious. In Singapore's status-conscious and family-oriented culture, academic and career success often reflects a family's reputation. Rooted in values of filial piety, many students feel pressure to pursue high-status careers such as medicine or law so as to bring pride and upwards mobility. Hence, nursing is not merely a personal choice, but a decision shaped by cultural ideals of what success should look like, thus reinforcing the profession's lower standing within the social hierarchy. Additionally, the fundamental misunderstanding of the nursing role compounds this issue. Many students in the same study describe nurses as assistants who simply follow the doctor's orders, reflecting the belief that nurses lack autonomy or authority. This stems from a broader cultural divide where technical and intellectual work like medicine is valued higher than routine and hands-on care work like nursing. Hence, nursing is positioned as secondary and supportive rather than skilled and professional, reinforcing its low cultural status despite its complexity and expertise. Thus, when a profession is culturally framed as a low status and last resort option, it inevitably struggles to attract students because it offers little perceived recognition, social respect, or prestige. However, this lack of recognition persists beyond entry into the workforce. During COVID-19, public gestures like clapping were meant to celebrate healthcare workers. Yet, in a study conducted in the UK in 2022, many nurses felt ambivalent. They saw applause as a hollow substitute for real support, such as fair pay, better communication, and adequate staffing, while others dismissed clapping as a political distraction from chronic underfunding. These reactions reveal how symbolic acts, though well-meaning, fail to address deeper issues and highlight a cultural contradiction, where society praises nurses symbolically but fails to value them materially. Because nursing has rarely been valued through tangible means, symbolic gestures like clapping are perceived as superficial and empty, and over time, this cultural devaluation contributes to burnout and disillusionment. A 2021 review found that over a third of nurses experienced high emotional exhaustion during the pandemic, driven by inadequate staffing and resources the very issues applause could not address. Ultimately, nursing's challenges extend beyond pay or workload. They stem from a persistent symbolic devaluation, where the profession is framed as low status, subordinate, and only superficially celebrated.
Gendered expectations also contribute to problems in attracting and retaining nurses, as nursing and many other allied healthcare roles are predominantly female and is viewed as a feminine job. In almost every culture, women have been assigned a reproductive gender role based on the biological reproduction at home, while men are assigned a more productive role revolving around income generating activities. These assigned gender roles thus restrict women and push them towards traditional caring roles, one of them being nursing. However, even after choosing such a profession, according to a study conducted in 2022, 65% believe that being a nurse had a negative impact on women's social lives and that nurses delayed marriage due to the demands of their profession, causing them to lack their family support when choosing the profession. Furthermore, there's a lack of structural support for domestic responsibilities such as affordable and flexible childcare, shared domestic labor norms, etc. This causes nursing professionals to hold two full time caring jobs, one paid and unpaid, leading to extreme role strain. With the lack of familial and structural support, many nurses will be burnt out from having such taxing stresses in their professional and social lives. However, in spite of such beliefs people have on women's role in nursing, men are not viewed as suitable replacements for female nurses as they are perceived as less skilled, even if they are qualified and experienced. Male nurses are viewed as untrustworthy, disorganized, irresponsible, careless, disrespectful, and a sexual threat. Last but not least, as these men are in a feminine job, their masculinity is questioned, with people viewing them as a homosexual or patients using female terms to address them, such as sister, matron, and missy. This causes patients to not trust them and discriminate against them. This makes them vulnerable to misinterpretation of their actions or distrust in their intentions, thus provoking shame in these male nurses.
Introducing the first structural aspect of this issue would be the hierarchy of professions in the healthcare workforce. We have researched the hierarchy of nursing in Singapore and compared it with the status in Denmark. In both Denmark and Singapore, the healthcare system reflects a hierarchy deeply rooted within the workforce and society, where doctors continue to hold dominance over nurses in terms of prestige, authority, and decision-making. From the Danish perspective, medical prestige has long been shaped by doctors, especially those in life-saving and acute specialties. These doctors hold the most prestigious positions and have historically ruled the game in healthcare by defining professional values and dominating clinical authority. In contrast, nurses remain in a subordinate position. Although they have the skills to observe and understand clinical processes, they are unable to challenge the rules and structures set by doctors. Even with efforts to professionalize and academize nursing, the field is still undervalued, and nursing students continue to struggle against perceptions of nursing as lacking legitimacy within healthcare. Similarly, in Singapore, strong hierarchies also shape patient care and decision-making. Nurses who often observe patients' conditions firsthand face challenges in convincing doctors to act on their clinical judgments. Their assessments are often overlooked in favor of quantifiable data, reinforcing the idea that doctors' decisions carry greater legitimacy. Escalating cases without doctor approval, such as activating the medical emergency team, can even be seen as questioning a doctor's competence, which further entrenches doctors' authority. Less experienced nurses may internalize this subordinate role and hesitate to speak up, reinforcing the unequal power balance. Collectively, both contexts reveal how doctors maintain dominance in healthcare hierarchies. This ultimately results in the deterrence of pursuing nursing as a career.
I will now examine how staffing ratio influence extraction and retention in nursing.
Before 2016, Queensland Hospital, like many worldwide, cut costs by stretching nurses' team, often caring for 5 to 6 patients by day and up to 7 at night. Research shows that extra patient per nurse raises the risk of 30 days mortality by 12%, while also increasing nurses' exhaustion and job dissatisfaction. Understaffed hospitals were rated lower in care quality and patient safety. This evidence pushed Queensland to legalise minimum ratio in 2016, 1 nurse to 4 patients on day shift, 1 to 7 at night. The results were dramatic: 145 deaths prevented, 255 fewer readmissions, and nearly 30,000 hospital days saved. For nurses, burnout decreased, job satisfaction improved, and retention rose. Staffing ratio tells us how many patients a nurse cares for, while shift scheduling determines when they work and how much they get rest. A study found that in Queensland, many nurses creating rosters had no formal training. Every participant said they received no guidance and most didn't even know how to apply fatigue policies. This often led to unsafe roster like quick return, a late afternoon shift followed by an early morning one, leaving almost no time for rest. The consequences are serious. Prolonged sleep loss causes fatigue, cognitive decline, and much higher risk of medical errors. In fact, sleep problems increases workplace injuries by 62% and 13% of injuries are directly linked to fatigue. For patients, this means more falls, more medication errors, and unsafe care. And long-term, it fuels burnout and turnover, with nearly 70% of nurses reporting fatigue and burnout in 2022, and many leaving within 2 years. Poor rostering doesn't just harm nurses, it undermines patient safety and drives up healthcare costs.
With the development of medicines and treatment plans, life expectancy of an aging population is lengthened. With longer life expectancy, chronic diseases and mental health issues are prone to rise, increasing hospital admissions. Additionally, a large shift in the demographic population causes more patient load and expectations, creating higher demands for healthcare workers, including nurses. In Singapore, a study on managing burnout in healthcare workers, including nurses, mentioned an aging population may cause higher demands in skilled healthcare workers in the future. This challenge mirrors one in Japan, where 29% of the population is expected to be 65 years or older. This is a problem in which Japan faces difficulty in managing a super aging population to retain nurses in healthcare. This problem regarding a super-aged population in Japan shows how it is important to address and solve the turnover rates of nurses in Singapore, while the elderly population continues to increase.
So now let's talk about some of the recommendations that Singapore can do to attract and retain nurses in the healthcare workforce. So for our first recommendation is workforce expansion and retention. The goal here is to strengthen Singapore's local nursing pipeline and ensure that experienced nurses remain in the profession. Internationally, the European Union's Grow Your Own initiative have stabilized supply by expanding domestic training, while the Philippines Nurse Deployment Program increased workforce presence in rural areas. Similarly, return to practice programs in the UK and Australia successfully re-engage inactive or retired nurses. In Singapore, we can expand nursing intakes, offer bonded scholarships in high-needed specialties, and create return to practice programs. We can also introduce fast track options for students, expand postgraduate programs, and implement more streamlined integrated study pathways so that polytechnic students can enter university more easily and graduate faster, combined with strengthened career progression and leadership pathways. These strategies will help build a sustainable nursing workforce. Our second recommendation is bundled incentives. Research shows that salary increases alone are not enough to keep nurses long term. Systemic reviews and case studies from Asia Pacific and Europe confirms that combining financial incentives with career development, mentorship, and better workplace condition is far more effective. For Singapore, we can implement a total package retention model. Salary top-ups, protected professional development hours, structured mentorship, staggered retention bonuses, and improvements to rostering and rest breaks. Bundled supports help ensure nurses feel valued both financially and professionally. Finally, our third recommendation is to expand flexible work arrangement and part-time options. Evidence from Canada and the UK shows that job sharing, part-time roles, and self-rostering system improves morale, satisfaction, and retention. Nurses who have greater control over their schedules are more likely to stay in the profession. In Singapore, we can pilot job sharing roles, widen part-time contracts for caregivers, and roll out electronic rostering to allow more flexible scheduling. Ensuring equal benefits and career opportunities for part-time staff is also crucial to make this approach sustainable. Together, these three recommendations, expanding the workforce pipeline, implementing bundle incentives, and offering flexible work arrangement, can help Singapore attract and retain a strong, resilient nursing workforce for the future. And that is the end of our presentation. We hope that you have enjoyed it. Thank you.